We don't have enough short-term or long-term data on the efficacy and safety of the vaccines. Like, you're seeing a fair amount of breakthrough infections. Here's my message. Fully vaccinated people will need treatment. Stop blocking early treatment, right? Because if you want to demonize the unvaccinated, like, oh, you got sick, we're going to blame you, tough on you. I don't think they're going to have that same attitude when the vaccinated people get sick. So if I can prey upon them to listen to us, to offer some treatment for those worthy, hopefully that would fall upon some open ears.
The potential reduction of long COVID, both with the infection and the vaccine.
As you and I both know, long COVID is just devastating, right? You want to avoid that at all costs. And so another reason to get early treatment out there. These long haulers, many of them have to stay on ivermectin. Even my colleague, I mean, he's been at it 8 months now. He has to take it 2 to 3 times a week. As soon as he stops, the symptoms come back. And so, I mean, it's a good message and a bad message, meaning that we can help you, but it requires maintenance therapy. I'm just going to summarize and give general statements. Is my belief that we don't have enough data. We don't have enough short-term or long-term data on the efficacy and safety of the vaccines. That is an evolving situation. I don't believe it's a settled science. I know that people are adamant that it is the cure for the pandemic. There's a lot of pro-vaccinators. There are a lot of hesitant vaccinators. I hate the term anti-vax because it lumps everyone who has a concern about the vaccine in one camp. And there's a lot of really smart scientists who study the immunology, have questions on it. And so I just hate that it seems so settled when it's not. I mean, you can see the data is evolving every day. You know, we're learning new and different things about the variants and different vaccines. And I just think that we need more data. It shouldn't be a controversial position, really.
So do we know how long natural infection immunity lasts?
Well, there's been a couple of recent studies, right? There's the VA study of healthcare workers. There's Cleveland Clinic. I think over the past, that Cleveland Clinic study showed in maybe 1,500 with prior COVID, and there's almost no infections. And that was over a year plus period. So again, that's another question. We need more data. And I think more data will come out. I mean, we can follow healthcare workers. We can follow others. Probably healthcare workers are the best, right? Because they're kind of easy to get to and study. And I think there's longitudinal studies going on, but it seems to hold up very well.
Yeah. Agreed.
Which is a really great message. It's a great finding, right?
Agreed. And if you look at previous infections with SARS-CoV-1, not 2, the antibody protection continued for 2 years and then declined in the 3rd year. And T-cell protection continued for 10 years.
Huh.
So that is 1. So of course there is a difference with 2, but still there is some extrapolation that can be done.
Oh, I agree.
Your protocol recommends taking weekly ivermectin for prevention. What is the end game, as surely one would not want to take ivermectin for the rest of their lives?
So number one is, if you can envision where we have an R naught that's so low and such a low case incidence where it's rare to see it, you could stop taking your ivermectin. Another is people take aspirin every day, statins every day, beta blockers, ACE inhibitors. I mean, now I could see why a healthy person wouldn't want to be relied on a medicine, but what's lucky is that it seems to be very safe. And so it wouldn't be the worst of scenarios if you had to do that, but I envision a time when once the public health systems realize that we need complementary and a multi-pronged approach, I think we can get the case rates and incidents down to you don't have to take it forever. We recommend taking weekly ivermectin for high-risk individuals, and that's in a little bit the eye of the beholder. We leave it, we know what the risk factors are, right? It's older, comorbidities, diabetes, that obesity, that kind of thing. But yeah, you could just do an early treatment protocol. Just keep it on hand and take it as soon as you get a symptom.
What kind of efficacy and which symptoms seem to respond to ivermectin in the realm of vaccine injury? How about numb lower legs, difficulty walking as treatable post-vaccine without IVM?
So I haven't treated that form of post-vaccine, but I've treated a lot of more of the inflammatory ones like myalgias, arthralgias, fatigue, headaches. Those disappear on ivermectin. I just was in an international Tess Laurie put together this cool Zoom this week, probably maybe 40 or 50 of us from all around the world, part of the BIRD Consortium and otherwise. And we talked about long haul and post-COVID and hearing the experiences of others. And there was one physician who had a really dramatic clinical anecdote of someone with a really bad neuropathy. I think they were insensate on one side or another, or they had some really terrible neurologic symptoms, which absolutely resolved with ivermectin. But that's just a clinical anecdote. So I offer that as a possibility.
Will there be a suggested prophylactic dosage for teens avoiding the vaccine? Children too, mask mandates have been dropped in school. And second is, as the data continues to show the vaccine losing its efficacy, do you suggest prophylaxis with vaccine dosing with vaccine?
So for number one, we have not really recommended young folks to we haven't recommended that they prophylax because they really do weather this well. But I would say for children, it's probably best suited just to have an early treatment, right? It's just keep it and treat very early. I think they're going to do just fine. Most of them do it very well. That's even without treatment. So doing an early treatment for, someone under 18 is reasonable. If you want to be more risk conscious or you are concerned about maybe, there have been some unfortunate severe illnesses in kids, but I will argue they haven't been treated. I haven't heard of ivermectin failure in a kid. Maybe you want to prophylax, but we don't recommend prophylaxing children. Number two, yes. Yep. I mean, as like I said, the data is evolving, and if you're starting to see data where efficacy is waning and there's a lot of breakthroughs depending on which vaccine or not, why not? This is a multi-pronged approach. So, we've used that phrase that we consider ivermectin is a bridge to vaccination for those areas, who don't have it yet. I think would be a bridge to it. And it's also a safety net for vaccination. And that's the other way in which we think it could be used, is that if the vaccines are losing efficacy, you could support yourself with ivermectin.
Is there any study or set of studies together with, let's say, ivermectin or vitamin D and mask and social distancing, which elevates the protection to the level of a vaccine?
So I believe if you look at the data from the prevention trials of healthcare workers, numerous trials from different areas of the world. So Argentina, a couple places, not just the Carvalho trial, right? There's the Chala trial in Tucumán that replicated Carvalho's findings. The Indian AAIMS in Delhi did theirs, did their prophylaxis of healthcare worker trials. You're finding equal and sometimes superior prevention against infection. So the answer is yes. There is non-vaccine prophylaxis treatment which are equal to superior to vaccines.
What is next for you in terms of your own career, in terms of FLCCC, in terms of this branding that you have, this advisory that you've been doing, advocacy that you've been doing? You are a name that is, I think, almost now known world over, at least in the medical fields. How do you build on it? What is next?
So we have another disease in which we have developed a highly effective protocol, and that disease is bacterial sepsis. We are going to tackle that next, and we hope to capitalize on our recognition to bring forth just a profoundly effective protocol for sepsis. And we have more research to come out to support it, and we hope to transform the treatment of sepsis worldwide.